Hi, my name's Justin, and today, alongside my teammates Maruk, Sarah, and Mohammed, I'll be helping to present a little case study we've prepared on the topic of fetal imaging, with a focus on the ethics of 3D ultrasound. We will be discussing some of the procedures that are in place, the pros, the cons, and a general analysis of the technology. Foremost, a 3D fetal ultrasound, or a 3D sonogram, is an imaging practice that uses sound waves to generate an image of a developing fetus, which allows insight into fetal development and health as the pregnancy continues. A major advantage of 3D ultrasounding, as opposed to other forms of ultrasound visualization, is the ability to identify birthing defects such as heart malformation or impaired surface development, that is, development of the skin, hands, feet, or face. While 2D ultrasound is able to identify some similar defects, to achieve the same level of analysis, the technician must sift through various different angles or planes of study, as opposed to the 3D construction modality, where multiple planes of analysis, which are referred to as volume echoes, are combined and coloured digitally to produce a lifelike 3D image of the developing fetus. There are two main methods of collecting this information: invasive during early pregnancy or non-invasive after the second trimester, but both follow the same principle. A transducer emitting high-frequency sonic pulses is moved across the surface tissue, which then collects the reflections or echoes of these pulses, which is sent to a computer for display as an image and interpretation by the operating technician. Due to the complexity of the images received and the amount of noise or transformations that the pulses are exposed to, it takes a large amount of practice and skill to accurately operate these machines safely and diagnose the observed results. Misinterpretation of these results, or failure to understand the physical effect of the procedure on an embryo or fetus, can have some serious ramifications. In the following scenario, we have a woman inquiring after an ultrasound. Let's have a look.
Hi, I want to get a 3D ultrasound done for keepsake.
Sure, I can book you in now. How many weeks pregnant are you?
I'm 25 weeks into my pregnancy.
Sure. Please lie down, it won't take long.
Hi there, that was quick. You may have noticed a few things were missing. There was no information requested by the technician regarding a variety of factors, including the results of any previous ultrasounds, whether there were any diagnoses made or recommendations for further action in the first place, whether the mother was up to date on routine inspections and how long had passed since the most recent examination. While ultrasounds are considered to be a safe technology, there are a number of factors that patients are simply not aware of that can impact the health of both them and their baby. Now let's try that again.
Hi, doctor. I want to get a 3D ultrasound done for keepsake.
Have you had your routine ultrasound done before, and how many weeks are you into your pregnancy?
Yes, I've had my routinely ultrasound performed already, and I'm 25 weeks into my pregnancy.
I would not recommend any more ultrasounds, as you have already had your routine once performed, and now you are in your second trimester. According to various studies, ultrasound later in pregnancy can have numerous health implications.
Oh, what kind of health implications, doctor?
Well, there are bioeffects of medical procedures, such as ultrasound. These bioeffects are thermal and non-thermal. Thermal bioeffects is the amount of ultrasound-induced intracranial heating which increases with the gestational age and the development of fetal bone. Ultrasound can produce biologically significant heating in the fetal brain. The rate of heating near bone is rapid, with approximately 75% of the maximum heating occurring within 30 seconds. The threshold of irreversible damage in the developing embryo and fetal brain is exceeded when a temperature increase of 4 degrees Celsius is maintained for 5 minutes.
Is this the only risk?
Well, diagnostic ultrasound employ a pulse sound wave with the positive and negative pressures. Research has suggested the sound waves are audible for the fetus. While this has found to not cause any damage to the newborn's auditory system, it's still unknown if it's likely to be a potential risk if the procedure is performed over a few generations. So I would not recommend a 3D ultrasound for you.
Thank you for all the information. I think it's best if I don't have the ultrasound since it may be a potential risk to my baby.
Now, here our doctor followed a much better approach. Of importance, he identified the patient's history, he identified some of the health implications of the procedure, and he recommended against the non-necessary action and by doing so minimised potential risk to both the mother and the baby. If the patient had a sufficient reason, such as a medical recommendation or a sufficient cause for concern, the doctor may have then continued to inquire and may have proceeded with an ultrasound or even some other method of analysis. It's important to retain, however, that in acquiring any imaging aside from a simple photograph, the patient will be exposed to energy, in this case sound waves, which ultimately may have adverse effect. It's part of the duty of any operator to ensure that these procedures are not carried out unless the predicted benefit can outweigh that cost. Thanks for listening to our presentation, and goodbye.